All right, so someone asked me to go through my process or my approach to plastic surgery. So I thought this could be kind of fun. So in general, let me summarize it with the purpose of plastic surgery and all surgery is to solve a problem. So the first thing I do when I see a patient is figure out what is their problem. And we figure out the problem by listening to them, listening to their concerns, what bothers them, most importantly, figuring out what their goals are and what they hope to achieve from plastic surgery. Then, as the physical exam, I like to examine whatever body parts they're concerned about and come up with a diagnosis or a definitive explanation of the problem. So, for example, if someone comes in and says, my face looks old, well, let's nail down exactly why your face looks old. What are the problems that we can solve to make your face look younger? So, step one is define the problem. Step two is come up with a solution. Now, there's oftentimes many solutions to the same problem. The key is using the solution that is best for a given patient. And that depends on what how severe their problem is, as well as how much recovery time they have and what they're willing to go through to get it fixed. The next step's the hardest part, and that's helping the patients decide what they should do. In other words, oftentimes there are interventions or solutions to the problems that are a lot less invasive and have a much shorter recovery, but they're not going to give the result that the patients want. So I'd hate to have someone waste their time and money on an intervention that isn't going to get them to where they want to be. So this third part of the discussion of the process is discussing the solutions to their problems and helping them navigate those different solutions so they can determine which solution is best for them. The next step is executing the plan, which is likely some type of procedure or intervention. And after that, it's helping patients get through the recovery period and managing any concerns or complications that they could have. Hopefully there are none, but should they arise, that's what we are here to do, is make sure that everything gets taken care of all the way to the end. And nothing makes me happier than seeing happy patients after a perfectly executed plan. So the whole process, except for the paperwork, is a lot of fun. Defining the problem, coming up with a plan, executing that plan, and taking care of them after surgery, the whole process is really great. In fact, we recently, my wife and I were out to dinner, and one of my patients was sitting at a nearby table, and I did not go say hello because I didn't want to blow her cover. I kind of gave her a nod and let her be, but she proceeded to come over to our table, and we were talking to her, and she was telling my wife how happy she was and how great of a plastic surgeon I was. And my wife's comment was very funny. My wife said, well, he better be, because that's all he does. So I do love plastic surgery. It is most of what my life is consumed by, but I'm okay with that because the whole process, except for the paperwork, is a lot of fun. So to summarize the process, step one, define the problems. Step two, figure out what the patient's goals are. Step three, figure out which solutions we will use to get them to that goal, to get people to achieve their goals. Step four, execute the procedure or perform the procedures. Step five, get them through the recovery process. Now, most of that happens in my head except for the execution, or step four. So a lot of it's not very entertaining, but I think that people are often very entertained by the surgery and the procedures themselves. And actually a lot goes into planning and preparing for those procedures as well that nobody really sees either. So to get a flavor for what goes into planning and preparing for an operation, you can check out www.orsetup.com. That is one of my websites where my partner and I keep all of our preference cards. and you can see all the different procedures and preference cards that we have and what goes into each one. And each operation is no small undertaking. There's a lot of thought and planning and preparation that goes into every single operation that we do. I hope you found this helpful. Please check out our website, restoreplasticsurgery.com. There you will find a price estimator that can estimate the cost of any combination of procedures that you might be interested in. You can also use our virtual consultation tool. It's essentially a way for you to send us your concerns along with photographs of your concerns, and we will respond with an assessment and our recommendations. On our blog page, there is a recording function called the SpeakPipe, and it's a place where you can leave audio recordings of your questions and things you would like discussed on a future episode. Finally, please follow us on Instagram and Facebook, and also check out our YouTube channel. Subscribe to the YouTube channel if you're watching this on YouTube right now. And lastly, we also have a podcast, Plastic Surgery Q&A, and you can subscribe to that podcast and listen to those episodes at iTunes or wherever you get your podcasts.